How the air quality in New York and New Jersey is very poor right now as smoke from those wildfires in Canada continues to smother that region. It is expected that the bad air could linger for days, if not weeks.
Yeah, and last month we saw some of that wildfire smoke hit the Chicago area, if you remember. Well, Christina Hamilton is the advocacy director for the American Lung Association, joining us now to talk about this crisis with air quality. Christina, thanks for being with us. We've seen how awful those pictures are on the East Coast. How concerned are you? Because this is moving south. Hopefully it won't keep tracking to the west, but it did hit Ohio. How concerned should we be here in Chicago?
Well, wildfire smoke poses a serious health hazard to people living and working in the area. And as of this afternoon in downtown Chicago, the air quality registered in the orange range, which is unhealthy for sensitive groups. So wildfire smoke contains tiny particles. Some are so tiny that they can travel deep into the lungs and even enter the bloodstream. So you can check the air quality in your area at airnow.gov, which tells you how much pollution is in the air and whether it's safe to go outside. And the winds shift quickly, so smoke can travel thousands of miles. So it is very possible that we could see even more impacts of the wildfire smoke soon here in the Chicago area.
All right, so if you're here in Chicago, not in New York, obviously the situation a little bit different for them, but what types of symptoms would somebody notice if they do go outside here in Chicago? What should they be looking out for?
So definitely coughing, shortness of breath. For individuals who are even more sensitive, such as older adults, children, people who are pregnant, the particle pollution from wildfire smoke can trigger asthma attacks, heart attacks, and stroke, and can even be lethal. So if you're starting to feel those symptoms, definitely go inside as quickly as possible, talk to your healthcare provider, because we really do see, especially for sensitive groups, that they can have a lot of those symptoms pretty quickly.
Yeah, people in sensitive groups, as you put it, and people with underlying health conditions. What about for people who are otherwise healthy? How dangerous could this be for everyone else?
So even for healthy individuals, if you're doing rigorous activity outside, that could be a hazard to your health. So again, check the air quality that day. And if it is even worse than the orange range that it is today, then try your best to stay indoors. Protect the air inside your home by keeping the doors and windows and fireplace dampers shut. Keeping an eye on any symptoms. If anything worsens, definitely talk to a medical professional. If you are a child or have children, know that their lungs are still developing and they breathe in more air and consequently more pollution for the size of their lungs than adults. So it's just important to be mindful of how you're feeling, especially after you check that air quality.
That's such good advice for the little ones. I've got one at home, and that was something that we were talking about. So we appreciate it. Thank you, Christine.